right, it's not my intent to pick on Dr. Fauci, but it just gives us so much material. All right. Again, he was this week. He was on yesterday. He was on Face the Nation, and he was discussing Christmas. All right. I mean, this is Dr. Fauci. Play clip number 7.
But we can gather for Christmas, or it's just too soon to tell?
You know, Margaret, it's just too soon to tell.
Well, it was more to the exchange, but he had to walk that back today. He released a statement clarifying remarks that he made over the weekend that it was too soon for families to consider gathering in person to celebrate Christmas. I mean, think about this for a moment. People are already making their plans for Thanksgiving and Christmas, buying airline tickets, plotting trips across the country. And, you know, this guy has gained too much power, and they scare too many people with all this stuff. Now, one of the issues that was also discussed was how many people need to be vaccinated. Now, you might recall last week, President Biden was asked by a reporter how many Americans need to be vaccinated for us to get back to normal. Not sure we're ever going to be there, but he said, quote, the vast majority, and he later added between 96 and 98%. Well, if that's the figure that we need to reach in terms of vaccinations, probably means we'll never get back to normal, at least not under this administration. But how high do we really need to get to reach what at one point was discussed as the goal, herd immunity? And how do those who have natural immunity fit into the equation? Well, with me now to talk about all of this and more is Dr. Bhattacharya, professor of medicine at Stanford University and one of the authors of the Great Barrington Declaration, a statement advocating an alternative approach to the COVID-19 pandemic last year. Dr. Bhattacharya, welcome back to the program.
Nice to be here.
Okay, so we're hearing this number somewhere between 85 to 98% of the population has to be vaccinated. Is that even possible?
Well, I think first, let me just clear up a couple of things that I think people have gotten very, very wrong, including, I think, Dr. Fauci about this. The vaccine does not seem to, after a few short months, to stop disease spread. We're seeing many countries that have widely vaccinated, Israel, Iceland, the UK, actually even the United States, have enormous case outbreaks despite widespread vaccination. The vaccine protects against severe disease. It's very, very good at that. It reduces the risk of death and mortality and hospitalization. But many, many people, including myself, have gotten infections after being vaccinated after a few short months. The evidence out of Qatar, for instance, suggests after 5 months, you almost get no protection against infections of the vaccine. On the other hand, natural immunity, that is immunity derived after you've recovered from COVID infection, you get very long-standing protection against infection. The right sort of sequence is get vaccinated and then don't worry so much about being infected, because really we don't have a technology to stop that. The lockdowns didn't stop that. The vaccines don't stop that. What does herd immunity mean? Herd immunity means there's a sufficiently large fraction of the population that's immune so that the disease isn't spreading in the population. When one person meets another person, the person they meet, even if they're sick, you're immune, so you're not going to get the disease from them. That's what herd immunity means. What herd immunity will look like is not zero COVID. I think that's another problem in the way that the press, and I think Dr. Fauci sometimes talks about it. It's not a synonym for zero COVID. Even when we are in herd immunity, the disease will continue to circulate in the population. That sounds scary, but it shouldn't. Because if you're vaccinated or if you're COVID recovered, the second time you get it, the next time you get infected, it's not going to be so bad. It tends to be much, much milder than if you got than the first time you got it. This disease will circulate forever. We have no technology of eradicating it. We need to tell people that to stop being so scared about it.
So you've laid out a lot there. Let's start with the issue of the herd immunity and the equation there. And I think it's good to clear this stuff up. This is not like the silver bullet that makes COVID go away. In fact, it's mutating, and so we get these different variants. And it could be that we're constantly changing the vaccine. In fact, mentioning the vaccine, I was looking at a report, New England is home to the 5 states with the highest percentage of fully vaccinated population, yet hospitalizations and death hover near pre-vaccination levels. Because, as you said, it's not completely stopping it. It's bringing down the dire effects of COVID, but people are still getting it. So we've had about 44 million people that have had COVID in our country. So they would arguably have natural immunity?
Yep, definitely they have natural immunity. Actually, probably the number's probably quite a bit higher than that, probably 3 times higher than that. For every case that's identified with COVID, there are probably three or 4 other people who had infected but were not identified as cases because their infection was so relatively mild.
That would be what? I mean, that'd be 130.
Half the population.
Yeah, half the population. So when you take you take that with the 50+% that's been vaccinated. Now I know there's some overlap on that. We should be getting close to that number that everybody talks about, 80% of the population or more having either natural immunity or vaccination, would we not?
Yeah, except that the vaccine immunity doesn't stop disease spread very effectively after a few months. So the disease is still going to circulate. You're seeing this in the New England states. You saw that in the South earlier this summer. The disease will continue to circulate. And, immunity does decline over time. But the key thing is the protection against severe disease does not seem to decline that much over time. You're still protected against so for instance, I had the vaccine in April. In August, I got COVID. It was a bad cold. It was really, I wasn't happy with it, but it was, I wasn't hospitalized, and I was very glad that I had the vaccine. It protected me against more severe disease than I would have otherwise had. Same thing with people who have had COVID and recovered. They actually, the data suggested at 1 year, only 0.3% of people who had COVID and recovered. A year later, only 0.3% get COVID again. 0.3%. So that's even stronger than the vaccine in terms of infection.
Why is that not being discussed by the CDC and the federal government?
I am at a loss to understand the actions of the CDC. They seem like they want to, they seem fixated on a strategy of eradicating the disease. The problem is, or when you see Dr. Fauci talk, he talks about reducing the number of cases to a minimal level. The problem is that it is not. We have no technology to stop to eradicate the disease. The vaccines, as I just said, don't stop the disease from spreading, and the lockdowns failed to do so either. We have no technology to do that. Instead, so what the CDC has been doing is they've been telling people we have to make all these changes in our life in order to do an impossible goal, which is get rid of the disease. Instead, what they should be doing is they should telling people how to manage the risk around this disease. That starts with vaccination, especially if you're old and vulnerable. You absolutely should get vaccinated. And then live healthy lifestyles. All kinds of interventions that are now available that weren't available, monoclonal antibodies, for instance. We should tamp down the fear around this disease and instead give people tools to manage the risk.
So what about this new drug that I think from, is it Merck, that is out with a treatment once you have COVID that apparently is super effective? Does that hold promise?
It does look like it holds promise. We'll see, though. I mean, you don't decide based on press releases whether a drug works. You wait until you see the data. I have not seen the actual.
I forgot.
Data
I'm talking to a scientist, not a politician.
Well, I mean, if it works, I'll say so. If I don't think the data are good, I'll say so. I mean, it depends on what the data show. We do have drugs that work, like the monoclonal antibodies work. They actually have very, very good evidence behind them. If you're hospitalized, we have a much better protocol than we did last year. This is no longer the kind of disease it was last year because we have tools to manage it. Right. Let's tell the population that.
Well, we have
no longer fear it.
We have a lot more knowledge, and that's what people are, I think, hesitant about. Now, when I had it in July of last year, they tested me, said, "Yeah, you got it. Go home. If you can't breathe, call us." That was it. My wife had it a month later, and they had sent her home with like 5 prescriptions of different things. And so the protocol has changed over time because we have learned more. And, the recommendations from CDC it keeps changing, but they're not putting all the facts on the table. And I think one of the biggest hesitancies, as you pointed out, this idea that everybody's got to get vaccinated and that's what's going to eradicate this virus, if they would just have an adult conversation with, all right, if you've had the virus, you are protected, but if you're still in a high-risk category, we'd recommend you go ahead and get vaccinated anyway on top of having natural immunity. You know what? I think a lot of people would buy that, but they're not doing it that way.
Instead, they're like focused on vaccine mandates, which are essentially like ripping society apart. Huge numbers of working class people, teachers, firefighters, nurses, essentially being let go from their jobs, even though they've had COVID before and they don't really, I mean, the vaccine doesn't protect them all that much. They're focused on vaccinating a young population when in fact there's still, I think, like 10, 15% of the older population still unvaccinated, still unprotected.
I mean, think about that. Think about that for a moment. The very healthcare workers that we say are going to be in short supply because we're overrunning the hospitals, we're forcing them out. I mean, aren't we shooting ourselves in the foot here?
We absolutely are. It doesn't make any sense. And they were heroes of last year. They worked all through COVID, essentially providing services to people. And now we're turning around and saying, okay, you had COVID, you think you're recovered. If you don't get vaccinated, we're going to fire you and replace you. It's not.
And my daughter is one of those. My daughter was an ER nurse, worked with COVID patients. She got COVID. She had the antibodies, but fortunately, she's in a hospital yet that has not come down with the iron fist that the administration is pushing. But I mean, she's talked to a lot of her colleagues, a lot of her coworkers, just like what happened in New York. They're going to walk out. They're not going to do this, especially young, healthy, who are concerned. Whether it's, I mean, this is an early. The vaccine is early. There's still some unknowns about it. If we were 5-10 years down the road and all of these things were known, maybe people wouldn't be as hesitant.
Yeah, I think your daughter, I hope she doesn't get put in that situation, but so many nurses around the country have been put in that situation where they have to decide. And it's not unreasonable. Like, we have a vaccine, I think it's pretty safe. But like, if you have concerns, well, I mean, I suggest go talk with your doctor and make a good decision that works for you. Instead, we're coercing people, threatening their jobs, harming the healthcare system, because now people are they're actually going to be hospital overruns. And then after that, you're essentially saying, if this vaccine is so good, why are you forcing it on me? You're going to create vaccine skepticism about other vaccines, about public health generally.
Yeah.
It is a terrible policy, and I really don't understand it. It's this coercive policy instead of just treating people like adults, telling people what the data say.
So, Dr. Bhattacharya, is there any way now at this point to unwind this knot, for them to walk this back in a reasonable way so that we can move toward protecting those who need to be protected and keep our economy moving, our hospitals functioning? Is there a way they can do that?
I mean, I think you saw Dr. Fauci just do this with Christmas, right? So yesterday he basically says, there's in Dr. Fauci's fantasy land, there's always winter but never Christmas, right? He says, but in effect, but now he walks back and said, well, I'm going to meet with my family. I think they should start doing that. They can say the right things now, even now, and that would build trust. I mean, I think they don't need to keep defending a goal that is impossible. We cannot have zero COVID. Start telling people the truth, which is that we have much improved treatments. We have vaccinations that are fantastically good for preventing severe disease, and start trusting people to make good choices. Empower people, empower their providers, and good results will happen. I think it's still possible.
Well, I hope they take your advice, Dr. Bhattacharya, because I think that's exactly what needs to happen is step back, have reasonable conversations with the American people, treat them like adults, and let them make the decisions that they consult along with their doctors that are best for them.
Yeah, I think so too.
All right. Thanks so much for joining us, Dr. Bhattacharya. Always great to talk with you.
Great. Thank you, Tony.
All right.